Papi, whatever.
Hello everyone, we have excited news. My dear patient, she came all the way from Alaska to have surgery, rhinoplasty with me and my team. Everything looks great. Yes, we had photograph before the surgery, at surgery day in the morning. You can see it's very early, it's like 6 days after surgery. You can see a change from the front view. I create beautiful definition for the nose with lifting up, stretching the skin, basically bridge augmentation, and cutting the bones. As I tell always, there's a lot of swelling here. Second week, third week, it will slowly come down. It's going to look more natural. And if you check the tip part, very naturally we give a definition for the tip. You can see the great change, but it's really looking very natural. And from the base view, smaller nostrils, but proportionally nice. So it's not looking too small, it's strong, not collapsed. Probably you should breathe better than before, if anything. So it's looking very natural. Best part comes, it's a great change. This part was empty and we start the nose in a favorable position, more higher position, make reduction this part, augmentation this part, and tiplasty to give a beautiful tip shape. As you see, we lift it up. It's a little bit over lifted because of the swelling. We make reduction here and augmentation here to create this beautiful balanced look. It suits her so well. And of course, she's very happy.
We're very happy with the result.
Great. Great. This is just 6 days. With time, what will change? This part goes slightly down because of the swelling goes down. It will look more natural. We have some swelling around the eyes. This is 6 days. We cut the bones and as you see, we don't have too much face swelling. And tip will go down a little bit. And this part is going to shrink first, then this is going to shrink slowly. Thick skins, this part is going to shrink slower than the upper part of the nose. It's going to heal slowly each month, maybe also each year. This skin redrapes over our new nasal skeleton. Is going to give a little bit more definition and also it's going to look more natural. We make this oily skin, the fatty part, a little bit less, and we stretch the skin. And we will do some skincare. It's going to make, even now, you can see the skin quality is better. But we will have some treatments for her to even achieve a better skin texture afterwards. Thank you so much.
Thank you.
Thank you so
Thank
much
you. I
for
appreciate
coming
this.
a long way.
I know.
really appreciate it.
I chose the right surgeon.
Oh.